I went to medical school at the University of Southern California, and then I went on to internship and residency at Mass General in Boston, Massachusetts. And then I went down to the University of Pennsylvania for my fellowship in gastroenterology, and I stayed there for my extra year of therapeutic training. I came here on the reference of another provider in our practice as we trained together. And so as soon as my husband and I came off the plane, we kind of knew. It's just such a nice landscape. It's really pretty. We both grew up in the desert, so we knew we didn't want to go back to that. And it was just warm and welcoming. Well, as a young girl, I actually went to school next to a hospital where my mom was an emergency room nurse and a critical care nurse. And so I would get out of school about an hour earlier before she finished her last shift. And I would go to the hospital and have to wait for her. And because I was there every day, I think the doctors and the nurses, they kept showing me x-rays and EKGs. I met some of the patients that were waiting in the waiting room. And I don't know, I always feel very comfortable around a hospital, probably from that experience. And then when I went to college, I really gravitated towards anatomy and physiology. And the only other thing I thought about was being a marine biologist, but there are only about 6 people in the world, I think, who train orcas. So my fallback was to become a doctor. Well, gastroenterology is a great specialty. There are so many organs involved in the GI tract, and there's so many diseases involved in the GI tract, and there's a lot of crossover between other specialties with gastroenterology. And we take anything from the esophagus, the stomach, the liver, the biliary tree, the pancreas, and we get to do a lot of things too. We do endoscopy, endoscopic ultrasound. It's just a very broad specialty where we get to see a lot of different diseases, and I just really enjoy it. And who doesn't have a GI problem? Well, I ask a lot of questions, so they should just expect to be asked a lot of questions. I like to get a lot of the details. My bucket list is pretty long. Someday I'd like to go scuba diving at the Great Barrier Reef, safaring in Africa, skydiving, maybe become a pilot. All things that I want to do when my kids are on their own, so I don't have to worry about them in case something happens to me. I would probably be a veterinarian, but not a veterinarian to dogs and cats, like big animals, like a veterinarian for a zoo or elephants, or even an aquarium, orcas, something big. I do like People magazine, and I kind of really like shoes. I spend a lot of time with my kids. I do like to play tennis, I like to ski, I like to be active outdoors. And as my kids have gotten older, the good thing is we can do a lot of these things together.